The way to think about arthritis is kind of like the tread on a tire, right? The more wear and tear, the more miles you put on a tire, the more you start to wear down the tread. Well, at some point, unfortunately, you're going to get to a bald tire. It would be nice if we could put the car in reverse and put the tread back on the tire, but unfortunately, we can't do that. The same is true for our joints. So all of our joints, where two bones come together, is a joint, and within our joints we have this nice, smooth, slippery cartilage covering over the ends of all of those joints, so we get that nice, smooth, pain-free range of motion. Just like the tread on a tire, the more wear and tear, the more miles we put on our joints, the more we start to wear down that nice, smooth, slippery covering. So initially it kind of becomes roughened, almost like sandpaper. And then when it rubs back and forth, it causes inflammation, which causes pain, swelling, and stiffness inside that joint, which is where we get those symptoms, and we start having that change in our quality of life and the things that we enjoy doing, because we start having more and more of those symptoms related to that progression of that arthritis. Well, eventually, just like the tread on the tire that we talked about, you start to wear down that surface even further, and eventually gets to the point where it's bone on bone, or that bald tire. And again, that's even more inflammation, which is pain, swelling, and stiffness inside that joint, which is where we get that progression where all of a sudden the things that we were doing before become less effective, and we become more and more disabled because of that pain within that joint.